Are young adults abandoning the use of condoms in favor of anti-HIV drugs? Is this a wise decision? This question has sparked a heated debate in the medical community. A new trend is emerging where young adults are increasingly relying on post-exposure prophylaxis, also known as PEP, and pre-exposure prophylaxis, or PrEP, for HIV prevention. Let's delve into the story of a worker at Malaysia's Carex condom factory. After facing a potential exposure to HIV, she promptly started using PEP within 72 hours. The result? She tested negative for HIV. Feeling relieved and less anxious, she now depends on PrEP for HIV prevention. But this shift towards PEP and PrEP raises some concerns. While these drugs offer a promising solution for preventing HIV, their increased use is linked to risky sexual behavior. Health officials have noticed a worrying rise in other sexually transmitted infections. While PrEP and PEP offer a promising solution for HIV prevention, their increased use is associated with risky sexual behavior and a rise in other sexually transmitted infections. The shift towards the use of PrEP and PEP has significant implications for public health. With these anti-HIV drugs becoming more prevalent, it's important to understand the ripple effects that are emerging. As more individuals, especially young adults, turn to these preventative measures, we're seeing a concerning rise in other sexually transmitted infections, or STIs. This correlation cannot be ignored. Health officials are sounding the alarm, emphasizing the need for regular STD testing and continued condom use, even when using PrEP or PEP. These drugs are effective tools in the fight against HIV, but they are not a silver bullet. They do not provide a shield against other STIs, and relying solely on them can pave the way for a surge in infections like gonorrhea, chlamydia, and syphilis. The key here is balance and education. While these drugs are a breakthrough in HIV prevention, they must be used responsibly and in conjunction with other protective measures. These anti-HIV drugs may prevent HIV, but they do not protect against other STIs. With the approval of the dapivirine vaginal ring for HIV prevention, there are now additional methods available for women. This small silicone ring, inserted into the vagina and replaced monthly, releases an antiretroviral drug, dapivirine, that prevents HIV from replicating. It's a game changer in HIV prevention, especially for women who may not wish to rely on condoms alone. The dapivirine ring has been approved in several countries, including Kenya, offering a new layer of protection against HIV. It's a discreet and user-controlled method, which can be particularly empowering for women. It's also notable for its effectiveness. In clinical trials, it reduced the risk of HIV infection by approximately 30%. However, it's important to remember, the dapivirine ring does not protect against other sexually transmitted infections, nor does it prevent pregnancy. Therefore, it should be used in conjunction with other prevention methods and not as a standalone solution. The dapivirine vaginal ring offers a new alternative for women in the fight against HIV. Despite these new prevention methods, the need for comprehensive sexual health education and practices remains crucial. When it comes to combating HIV and other sexually transmitted infections, there's no silver bullet. Each strategy, whether innovative or traditional, plays a critical role in a larger, comprehensive approach to sexual health. In an era where novel solutions like pre-exposure prophylaxis or PrEP have emerged, it's easy to overlook the importance of tried-and-true methods. Condoms, for instance, not only provide a barrier against HIV, but protect against a broad range of STIs. Regular STD testing, too, plays a crucial role in early detection and treatment, helping to prevent the spread of infections. What's more, responsible sexual behavior is a cornerstone of any effective sexual health strategy. This includes open communication with partners about sexual history and health status, as well as understanding and respecting each other's boundaries. So, while innovations like PrEP are important tools in the fight against HIV, they should be viewed as part of a larger toolkit. A balanced approach to HIV prevention that includes both innovative solutions and traditional methods is essential. In the fight against HIV and STIs, a combination of innovative solutions and traditional methods, guided by comprehensive sexual health education, remains the most effective approach.